Good afternoon. My name is Dr. Gene Freund with the Centers for Medicare and Medicaid Services. Welcome to today's IFC6 National Stakeholder Call. Before we start today's call, I'd like to go through a few housekeeping items. The webinar today is being recorded and will be posted on the CMS Current Emergencies website. All participants will be muted throughout the call. Closed captioning is available via the link in the CC window on the bottom of the screen. Members of the press are welcome on today's call. However, all press media questions should be submitted using the CMS Media Inquiries form, which may be found at cms.gov newsroom media-inquiries. Again, thank you for joining us today, and I'm now pleased to turn it over to John Blum, CMS Principal Deputy Administrator and Chief Operating Officer. John?
Well, thank you, Gene. Thank you to the whole CMS team. We are very pleased today to be able to describe new vaccine requirements that have been put forward today. There's really three principles to me that guide these rules. The first is that CMS worked hard to ensure that we create a whole system-wide approach. We want to make sure that our rules really respect and really follow how patients receive their care. We don't want to focus on just one care setting, but to ensure the best possible way that we are thinking about the whole system. The second principle is we want to make sure that CMS's rules are really well coordinated to other rules that have come out today. We recognize that not just the CMS rules, but the entire scope really have to be thought through. For those providers that are governed, paid for by CMS, please look to the CMS rules first. But we have worked very hard to ensure that we have one coordinated federal government system that creates consistency to the best we can. So that's the second principle. The third principle really is time. We want to make sure that folks have time to understand the rules, they have time to comply. We fully understand that this is brand new to some in the industry. And so we want to ensure that we are being as clear as possible, as transparent as possible, to ensure that we give folks, the entire healthcare system, time to comply, time to get ready, and time really to ask questions. We are coming here in the spirit today to explain, to really focus on the key questions. We have 10,000 people here joining us today, so we can't get to every question. But I can assure folks here that CMS will work hard to monitor. We will really work hard to explain and to ensure that we are being as clear as possible to help the industry. The last point really is we are coming here in the spirit of making sure that our healthcare system is as safe as possible. We see data throughout the day where we see variations throughout the country in deaths, in COVID cases. And so our goal is to ensure that we are keeping the healthcare system safe. We are keeping healthcare workers safe to really make sure that we have the best approach possible. But we'll take some time next to really walk through the key provisions to the rule. We'll save time for questions, and please know that we have dedicated staff who will work as hard as they can to ensure that we have the safest system possible, but we're also being the best possible partners to help guide the system forward. So with that, we'll turn to my colleague, Dr. Lee Fleischer, to really walk us through the rule, and then we'll stop for questions. So Lee, the floor is yours.
Thanks so much, John. It's a pleasure to be here and go through the rule. And Gene, if we could start sharing the slides. And fantastic. And the next slide, please. So the agenda, you've already heard opening remarks from John Blum, the principal deputy, and we'll go over the eligibility, the basic requirements, the enforcement, the interactions with the other regs, and the actions to take, and hopefully we'll have time for some questions and answers. So next slide, please. So we'll start with eligibility, and it's important to recognize upfront that the requirements within this rule apply to providers and suppliers, what we'll refer to as facilities. The staff vaccination requirements apply to the Medicare and Medicaid certified facilities that are regulated under the foundational Medicare health and safety standards, known as the conditions of participation, or COPs, the conditions for coverage, or the requirements for participation. The COPs, conditions for coverage, and requirements for participation were established by CMS to protect individuals receiving healthcare services from Medicare and Medicaid certified facilities. As we've discussed to this point, and John noted, patient safety is a fundamental principle to this regulation, and protecting individuals from COVID-19 across a variety of healthcare settings is the most important factor. The COPs help us ensure these protections, and if facilities want to participate in the Medicare and Medicaid programs, they must abide by the COPs. As you see on this screen, we've included 15 provider and supplier types within this regulation. This means that if you are one of the facilities listed, you must abide by the requirements established within this regulation. Next slide, please, Jean. So who is excluded? There are certain provider and supplier types that are not included in the staff vaccination requirements, including religious, non-medical, healthcare institutions, organ procurement organizations, or OPOs as they are frequently termed, and portable X-ray suppliers. Religious non-medical healthcare institutions do not furnish, on the basis of religious beliefs, medical items and services, but instead provide non-medical nursing items. CMS did not believe it was appropriate to impose the vaccination requirements in this rule or on RNHCIs and their personnel because a vaccine is a medical item that requires a medical intervention or procedure. For the OPOs and portable X-ray suppliers, both of these entities likely have staff who are indirectly included in this vaccination requirement through service agreement with applicable facilities. Additionally, CMS's statutory authority does not extend to some other kinds of facilities like assisted living facilities, group homes, home and community-based services, and physician offices. Again, these requirements only apply to facilities regulated under the COPs. This is a key element to remember when determining whether the staff vaccination requirements apply to your facility. We'll talk about the staff who may work between settings and our expectations based on the regulation momentarily. Next slide, please. If your facility is included in this regulation, then there are three basic requirements that facilities must complete. Number one, you must have a process or plan for vaccinating all eligible staff. Number two, you must have a process or plan for providing exemptions and accommodations for those who are exempt, which we'll talk about later, but include, but are limited to, testing, source control, physical distancing, etc. And you must have a process or plan for tracking and documenting staff vaccinations. Next slide. The key question you're likely asking now is, what is our timetable for meeting these requirements? We have two important phases. Phase one requires that within 30 days after the regulation is published or by December 5th, 2021, facilities have all processes and plans in place for vaccinating staff, providing exemptions, and tracking the staff vaccinations. It also requires that staff at all healthcare facilities included within the regulation must have received at a minimum the first dose of a primary series or a single dose COVID-19 vaccine prior to staff providing any care, treatment, or other services for this facility or its patients. Phase 2 requires that within 60 days, previous slide, please, after the regulation is published, or by January 3rd, 2022, staff must be fully vaccinated, with the exception of those who are granted exemptions from the COVID-19 vaccine or those staff for whom the COVID-19 vaccination must be temporarily delayed as recommended by the CDC. We believe the 30 and 60-day timeframes are reasonable and allow for facilities to implement staff vaccination plans while expeditiously getting healthcare staff vaccinated as quickly as possible. Next slide, please. We've covered the who, the what, and the when as it relates to which facilities are included within the regulation and what they must do. Now let's turn our attention to which staff must be vaccinated as part of each facility's plan. The vaccination requirements apply to all eligible current and new staff. Again, those who are not exempt or full-time teleworkers working at a facility regardless of whether they have direct or indirect patient care. The basic rule of thumb is that any staff member who is on-site at a facility, including in this requirement, or could potentially interact with others who provide direct patient care, must be fully vaccinated. This includes individuals who are on-site full-time, as noted on the list, staff who move between facilities, for example, a nurse whose shifts between the nursing home and an assisted living facility, and may have interactions with others who may provide direct care, and individuals who may be on-site part-time but have full-time responsibility in a facility not regulated by CMS. For example, an independent physician with privileges in a hospital who is admitting or treating patients on-site. The physician's office is not regulated, but being on-site at a facility, including this regulation, means the physician must be vaccinated. Additionally, the vaccination requirements also apply to staff performing duties off-site, so in a patient's home or other non-traditional clinical care sites. Finally, we note that the staff vaccination requirement does not work on telehealth as remote telehealth or payroll services, as these individuals do not have direct contact with patients or staff. Next slide, please. As indicated on this slide, we consider staff fully vaccinated when it's been 2 weeks or more since they had completed a primary vaccination series for COVID-19. We do note staff who have received all shots by January 4th, 60 days, are considered to have met the requirement even if they have not yet completed the 14-day waiting period required for full vaccination. A primary vaccination series consists of either the single-dose Janssen COVID-19 vaccine, staff receiving the multi-dose, the Pfizer COVID-19 vaccine or the Moderna COVID vaccine, or a vaccine regimen listed by the World Health Organization for emergency use in accordance with the CDC guidelines. At this time, we are not requiring staff to receive additional doses beyond the primary vaccination series or boosters to be considered fully vaccinated. The FDA has approved and CDC has recommended boosters for certain groups that previously completed a primary vaccination series. Because the science and the clinical recommendations around additional doses and boosters is evolving rapidly, we refer you to the CDC's interim clinical considerations for use of the COVID-19 vaccines currently approved or authorized in the United States for additional details. Additionally, CDC advises an additional third dose after primary vaccination for any individual who received a Pfizer or Moderna vaccine and has moderately or severely immunocompromised. We recognize that there may be other scenarios of staff receiving mixed vaccines, receiving vaccines abroad, participating in clinical trials, etc. We strongly encourage every facility to review the frequently asked questions document specifically to these requirements on the CMS emergency page. Next slide. One of the most common questions we have seen is, are exemptions allowed? The short answer is yes. CMS requires facilities to allow for both medical and religious exemptions in accordance with federal law. Facilities must have a plan, Facilities must have a process or plan in place that permits staff to request either a medical or religious exemption. This is one element that surveyors will seek to review. As you can see on the screen, there are specific requirements as it pertains to what level of documentation is needed for either a medical or religious exemption. We also encourage facilities to review the Equal Employment Opportunity Commission's compliance manual on religious discrimination for more information on religious exemptions. We want to be very clear that we are requiring facilities to have a process for handling vaccination exemption requests for staff as required under federal law, including medical conditions for vaccines are contraindicated or other reasons likely like sincerely held religious beliefs. However, providers and suppliers are not required to grant exemptions to staff who are not eligible, and no exemption should be provided to staff who are simply trying to avoid vaccination. Additionally, staff who have previously had COVID-19 are not exempt from these vaccination requirements. Available evidence, including some recently published study by the CDC, indicates that COVID-19 vaccines offer better evidence that natural immunity alone offer better protection than natural immunity alone than the vaccines, even after prior infection, help prevent reinfections, that the vaccine is the best way to prevent infection. And CDC recommends that all people be vaccinated, regardless of their history of symptomatic or asymptomatic SARS-CoV-2 infection. For those staff who are exempt for the reasons indicated on the slide, facilities should provide for accommodations, which could include, but is not limited to, testing, physical distancing, source control. This is ultimately up to the facility to decide how best to handle. Next slide. This regulation requires that facilities develop a process for implementing additional precautions for any staff who are not vaccinated in order to mitigate the transmission and spread of COVID-19. Under federal law, individuals who cannot be vaccinated because of medical conditions or sincerely held religious beliefs, practices, or observances may be entitled to an accommodation. CMS encourages facilities to review the EEOC's website for additional information about situations that may warrant accommodations. For those staff who are exempt for the reasons indicated on this slide, facilities again should provide accommodations, which include what I described previously, including assigning unvaccinated individuals to non-patient care areas with low risk to the patients. This is ultimately up to the facility to decide how best to handle. In all cases, facilities must ensure that they minimize the risk of transmission of COVID-19 to at-risk individuals. Next slide. There are a few other important elements that are important for each facility to know. Vaccination is the only option. This regulation does not include a testing option as an alternative to vaccinations. And secondly, there are no new data reporting requirements with this regulation. Now, facilities, specifically hospitals and nursing homes, are still expected to continue complying with the facility-specific data reporting requirements set forth in the emergency regulations issued by CMS in May 2020, August 2020, and May 2021, respectively. Additionally, facilities participating in several of our inpatient and outpatient quality reporting programs must collect data on the new COVID-19 vaccination coverage among healthcare professionals measure quarterly, with the first collection period for many programs beginning on October 1st, 2021, and running to December 31st, 2021. Next slide. CMS has established survey and enforcement process that it will use to ensure compliance with staff vaccination requirements. Checks for compliance with the requirements will be conducted by the state survey agencies during 2 periods: recertification surveys and complaint surveys. While on site, surveyors will review the facility's COVID-19 vaccination policies and procedures, a plan for vaccinating staff, providing exemptions, and tracking staff vaccinations, the number of resident and staff COVID-19 cases over the previous 4 weeks, and a list of all staff and their vaccination status. This information, in addition to interviews and observations, will be used to determine the compliance of the provider or supplier with these requirements. Finally, accrediting organizations will be required to update their survey process to assess facilities they accredit for compliance with vaccination regulations. Next slide. As previously discussed, CMS will leverage the state survey agencies to check for compliance with the requirements outlined in the Omnibus Staff Vaccination Regulation. Providers out of compliance will be cited based on the level or severity of noncompliance, with an opportunity to return to substantial compliance. For example, for hospitals, immediate jeopardy, the most severe and indicative of serious noncompliance, which would lead to termination within 23 days if the deficiency is not resolved, or condition level noncompliance, which would be substantial noncompliance, or the standard noncompliance, the least severe and indicative of minor noncompliance. CMS has a variety of established enforcement remedies for nursing homes, home health agencies, and hospices beginning in 2022. This includes civil monetary penalties, denial of payment, and even termination from the Medicare and Medicaid programs as a final measure. The remedy for noncompliance among hospitals and certain other acute and continuing care providers is termination. It is not our goal to terminate facilities from the Medicare and Medicaid program. In fact, we want to work with facilities to bring them back into compliance as quickly as possible so that every person benefits from safe and quality care. Termination is the absolute last resort, and after all other levers have been exhausted. It is important to note, however, that we will not hesitate to use our full enforcement authority to protect the health and safety of patients when our requirements are not met timely. Next slide. CMS recognizes that there are several vaccination-related requirements for healthcare workers. So we've established a hierarchy by which to follow. Healthcare facilities are generally subject to the new federal requirements based on primacy. If your facility is Medicare or Medicaid certified and subject to the CMS conditions of participation, then you should adhere to the requirements outlined in the CMS Omnibus COVID-19 Health Staff Vaccination Regulation. The CMS rule takes priority above other federal vaccination requirements, and CMS's oversight and enforcement will exclusively monitor and address compliance for provisions outlined in this regulation. There are rare situations where the executive order on ensuring adequate COVID safety protocols for federal contractors or the OSHA COVID-19 Healthcare Emergency Temporary Standard may also apply to staff who are not subject to the vaccination requirements outlined in the CMS Omnibus Staff Vaccination Rule. Facilities should review these regulations and comply with any other federal requirement as necessary. Finally, we have received many questions on the interaction of this regulation with state law. The bottom line is that this regulation preempts state law and/or state-issued executive orders under the Supremacy Clause of the United States Constitution. So, what are the actions to take? Do review the Omnibus COVID-19 Healthcare Staff Vaccination Regulation and the specific sections applicable to your facility. Do review the frequently asked questions document specific to this regulation on the emergency page. And do begin your process or plan for vaccinating staff, providing exemptions, accommodations, and documentation, and tracking staff vaccinations. And do note the two timelines at 30 and 60 days. Thank you. The key here is protecting patients. And I'll turn it back to you, Jean or John.
Jane, for questions.
Excuse me. Yes, we have some time for questions, and we harvested them from our conversations, and here they are. Dr. Fleischer, could you please recap for those listening in? What are the requirements and by when?
So, two important phases. Phase one requires that within 30 days after the regulation is published or by December 5th, 2021, that they have all processes and plans in place for vaccinating staff, providing exemptions, and tracking staff vaccinations. It also requires that staff at all healthcare facilities included within the regulation must have received at a minimum the first dose of a primary series or the single dose COVID-19 vaccine prior to the staff providing any care, treatment, or other services for this facility or its patients. Now, phase two requires that within 60 days after the regulation is published, January 3rd, that staff must be fully vaccinated. Of course, with the exception of those who've been granted exemptions from the vaccine or those staff for whom the COVID-19 vaccination must be temporarily delayed as recommended by the CDC.
Thank you. How many providers does this affect?
We believe that this will affect 76,000 providers and suppliers, which would cover over 17 million healthcare workers.
Does this requirement apply to staff who work off-site?
Absolutely. These requirements are not limited to the staff who perform their duties solely within a formal clinical setting, as many healthcare staff routinely care for patients and clients outside of their facilities. For example, home health, home infusion therapy. To ensure maximum protection, all staff who interact with other staff, patients, residents, clients, or PACE program participants in any location beyond the formal clinical setting, such as the home, clinics, other sites of care, administrative offices, off-site meetings must be vaccinated.
Does this requirement apply to full-time teleworkers?
No, individuals who provide services 100% remotely and who do not have any direct contact with patients and other staff, importantly, such as fully remote telehealth or payroll services, are not subject to the vaccination requirements outlined in this regulation.
What about a physician with admitting privileges in a hospital? Would they be covered?
Yes, a physician admitting or treating patients in person within a facility subject to CMS's health and safety regulations and included as part of this requirement must be vaccinated so that the facility is compliant.
And does this requirement apply to Medicaid home care services, such as home and community-based services?
No, this requirement only applies to those Medicare and Medicaid certified provider and supplier types that are subject to CMS's health and safety regulations. CMS's health and safety regulations do not cover providers of home and community-based services.
And will there be different requirements for existing staff versus new staff?
No, staff at all healthcare facilities included within the regulations must have received at a minimum that first dose of a 2-dose regimen or a 1-dose COVID-19 vaccine by the regulatory deadline or prior to providing any care, treatment, or other services in the facility.
Does the regulation include testing requirements for unvaccinated staff?
No, this regulation requires staff vaccination only, while CMS considered requiring daily or weekly testing of unvaccinated individuals. Scientific evidence on testing found that vaccination is more effective in infection control measures. CMS will continue to review the evidence and stakeholder feedback on this issue. However, facilities may voluntarily include a testing regimen alongside other infection prevention measures, such as physical distancing and source control. Of note, CMS did publish an emergency regulation in September 2020 that established new requirements for long-term care facilities, that is to say nursing homes, to test facility residents and staff for COVID-19. And CMS expects continued compliance with this requirement. Additionally, CMS encourages facilities not covered under this regulation to review the OSHA emergency temporary standard for separate vaccination and testing requirements.
Is there provision for certain individuals for whom a vaccination should be delayed? For example, because of a recent COVID-19 diagnosis?
Yes, the regulation addresses staff for whom COVID-19 vaccination must be temporarily delayed, as recommended by the CDC, due to clinical precautions and considerations.
Does the regulation include exemptions for staff that show they have COVID-19 antibodies?
No, staff who have previously had COVID-19 are not exempt from these vaccination requirements. As I noted, available evidence indicates that COVID-19 vaccines offer better protection than natural immunity alone, and the vaccines, even after prior infection, help prevent reinfections. CDC recommends that all people be vaccinated, regardless of their history of symptomatic or asymptomatic SARS-CoV-2 infection.
And is CMS planning to use the new COVID-19 vaccination coverage among healthcare personnel, or HCP, quality measures to monitor compliance?
No, providers participating in the inpatient, PPS exempt cancer hospital, long-term care hospital, inpatient psychiatric, and inpatient rehab quality reporting programs are expected to report on the new COVID-19 vaccination coverage among healthcare personnel quality measure from October 1st, 2021 to December 31st, 2021, as established in the various federal fiscal year 2022 payment rules. While this quality measure will provide valuable insight into the number of staff vaccinated over the course of the 3-month period, CMS will continue to ensure compliance with the new staff vaccination through the established survey process. As data becomes available, CMS will continue to evaluate opportunities to inform the survey process.
So could you review which rule applies again?
Absolutely. So if a Medicare or Medicaid certified provider or supplier falls under the requirements of the CMS Omnibus Staff Vaccination Rule, it should look to these requirements first. Healthcare facilities are generally subject to new federal vaccination requirements based on primacy. If facilities participate and are certified under the Medicare and Medicaid programs and are regulated by the CMS health and safety standards known as the conditions of participation, as I mentioned, the COPs, the conditions for coverage, and the requirements for participation, then they are expected to abide by the requirements established by the CMS Omnibus Staff Vaccination Rule. This takes priority above other federal vaccination requirements. CMS's oversight and enforcement will exclusively monitor and address compliance for the provisions outlined in the CMS Omnibus Staff Vaccination Rule, while also continuing to monitor for proper infection control processes as established under previous regulations. There are rare situations in which the executive order on ensuring adequate COVID safety protocols for federal contractors or the OSHA COVID-19 healthcare emergency temporary standard may also apply to staff who are not subject to the vaccination requirements outlined in the Omnibus Rule. Facilities really should review these regulations and comply with any other federal requirements as necessary. If facilities are certified under the Medicare and Medicaid programs and therefore are not certified, under the Medicare and Medicaid programs and therefore not regulated by the COPs, then the executive order in ensuring adequate COVID safety protocols for federal contractors or the OSHA COVID-19 healthcare emergency temporary standard apply. The OSHA employer temporary standard for facilities with greater than 100 employees applies to employers who are not subject to the preceding two regulations. And again, facilities should review the inclusion criteria for these regulations and comply with all applicable requirements. As I've noted, we at CMS really put the patient safety first, and we believe this rule does that. So we're going to really reinforce that our goal is ensuring the safety and health and quality of care of those we serve. And with that, turn it back to you, Gene.
Okay, so those were your closing remarks. Do you have anything else, or does John Blum have any comments?
Thank you, Lee. Thank you, Gene. Thank you to all the folks that have joined us today. There have been many comments throughout the chat for us to share the slides, and we'll post those to the CMS website. Please stay tuned for the link. But really want to thank folks today for joining us, and we will certainly do our best to continue to answer your questions and give all the support we can for these rules going forward. So thank you.
And thank you all very much for attending. This ends the session.